Hydrometrocolpos or Mucometrocolpos at the age of 9. This was a 9-year-old who presented with history of non-cyclical lower abdominal pain. Abdominal examination revealed a cystic mass equivalent to 18 weeks of gestation. The hymen was perforate, and the lower vaginal cavity and walls were clearly seen. We couldn't see the high vagina, so we suspected high transverse vaginal septum. Breasts and axillary hair were Turner stage 1, while pubic hair development was Turner stage 2. The initial ultrasound report by the radiologist was Hydrometrocolpos. Repeat scan by the gynecologist was same, with Mucometrocolpos as a differential diagnosis. Cryptomenorrhea was, however, downplayed because typically puberty in females follows a predictable pattern. Usually, the first menstrual period typically occurs about 2 years after telarchy. In this patient, the breast development was Turner 1, and therefore we do not expect that this is a case of cryptomenorrhea. So let's look at the transabdominal video of these patients. Bladder, the vagina, and here you can see some collection within the vagina, which continues upwards. So you see the vagina here with a midline stripe. Look at its fluid in the porch of Douglas. The upper obstructed part of the vagina. Now, not this area, what looks like bifurcation. We'll come back to that later. Not this particular area. And this is the cysts. Not this debris. Looking more like mucus rather than blood, because blood clots hardly appears as bright as this. So again, not this area, and what appears like a bifurcation here. We shall come to that later. I'm trying to define the vagina and the area of supposed obstruction. Vagina in transverse view. Trying to see if this lesion continues from the vagina, cervix, and up to the uterus or not. So this is all I can see here. Note that this appears like a rounded, well-circumscribed cyst with a thin wall. But remember that this patient was just 9 years old. So still trying to clearly define what the lesion is. You see that again, collection within the upper vagina and not the vagina stripe here. And the stripe stops somewhere here. Okay, now let's look at the next image. This was a translabial image with gel in the vagina. The tip of the syringe was at the hymenal ring, and 2 mils of gel was pushed in to the vagina to delineate the vagina. So here you can see this is the anterior wall of the vagina, posterior wall of the vagina, and you can see gel within the vagina. And look at this lesion here, not well defined. So if one looks at here, look at these air bubbles here, and note that the air bubbles stop somewhere here. So was this the area of the high septum or the area of the cervix? If it's the cervix, this appears short because at this age, this ratio of the cervix to the uterus is supposed to be 2:1. So also supporting the fact that there could be a high vaginal septum here. So you see that? Vagina clearly outlined, and not this air bubble stop somewhere here. So let's review these still images: bladder, the vagina, and look at the vagina stripe, stop somewhere here, and look at this collection within the upper vagina. Same here, but pay attention to this area. Why this bifurcation around this area? We shall come to that later. Again, look at this area here, measurement of the obstructed and unobstructed vagina, 2:5, making the length 7 centimeters. And again, note this area of bifurcation, and note that this is more cystic, and not this layering here, suggestive of mucus rather than blood. So this was what we found at surgery. When we tried to create a passage vaginally, nothing came out. So we decided to review our assessment, and we brought in an ultrasound scan to check whether we actually created a false passage or not. And that was when we discovered that the tip of the sound was pushing this structure. So we opened the patient up, and what did we find? Look at these cysts, which are tossed many times, and part of the cyst was sitting somewhere here. So now let's play this video again. So now what we thought of initially was that this was the unobstructed vagina, the obstructed vagina. But intraoperatively, we realized that yes, this was the vagina stopped somewhere here, and this was actually the cervix. This was actually the cervix. And look at this area here. So there was a biconate uterus, and this was sitting in between the two corners, in between the two uterine horns. So this was the cysts sitting between the two uterine horns. And here, with the benefit of hindsight, look at the thickness of the vagina here compared with the thickness of the cervix here. So the cervix here is thicker. Look at this. Thicker than the vagina here. So this was actually cervix, not the obstructed portion of the vagina. Now let's look at this image, this still image. You see this, the bladder? It's part of the vagina. So what was thought was the vagina here was actually the cervix. And at the summit of the cervix, look at this deviation here and here. And I was not sure what this was actually. So, but it turned out to be part of this torted cyst that sat in between the two corners. So, in this diagram, I will explain exactly what was found. So this was the vagina. So this actually is the cervix, this one here. This is the cervix, which I thought was the obstructed part of the upper vagina. So this is the cervix, this here is the cervix. And then you can see this upper end of the cervix. You can see this part going this way and this one going the other way. So you have two uterine horns in between. You have this, and this is what appeared to us as hydro or mucometrocolpos. So this is the anterior portion, cord-like cervix. Look at the corner and the tube, and where the cystectomy was performed. This was the posterior aspect. So this was where part of the cyst was, the uterine conua, and the cord-like cervix. So histology of the specimen was mature cystic teratoma. This video was obtained about 1 month after surgery. So bladder, vagina, cervix, body. So you can see that it's difficult making diagnosis of congenital uterine anomaly, especially in this age, where really there is no endometrial trial. I tried 3D, but it wasn't helpful. Of course, we already have a diagnosis, a surgery. So, many lessons learned. Thank you very much for listening.